Dr. Nancy just mentioned the stresses on New York hospitals. Tell us about the stress on your institution.
Well, at the hospital, we're seeing every day rising numbers very, very rapidly. I mean, it feels like a tsunami is about to hit. It started in the boroughs, and Queens and Brooklyn are being hit the hardest right now. But all over the city, we're seeing rising volumes, increasing number of patients that are presenting to the emergency room that are sicker than they were before, more utilization of our acute units. The ICUs are expanding very rapidly. Our need for increasing the ventilator support for those patients is happening very quickly. And of course, it's natural to have to use more PPE because we're seeing in the hospitals many more patients presenting. A larger percentage of the patients that are coming to the hospital now are infected. Many more patients, a larger percentage on the hospital wards, are infected. And when you think about all the numbers of people that have to actually see those patients throughout the course of the day, the burn rate will be very high. And we're trying very, very hard to conserve, but not put our staff in danger.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.